Minister, as you know very well, County Wexford is in crisis in terms of mental health and the lack of a mental health acute facility since the closure of St Senan's Psychiatric Hospital in 2013. It was a facility that served as a primary mental health institution in the region for over 150 years. There has been no replacement. There is no acute mental health unit in County Wexford. I think this is really shocking in the context of an escalating mental health crisis that we're witnessing nationwide. And it's deeply troubling, and it leaves a significant gap in the service provision in the South East. I was alarmed by the information I received. Well, I knew already, but I just wanted to confirm the exact figures just in a parliamentary question just literally before Christmas. It showed that there was over 1,000 people had presented to Wexford General Hospital's A&E department in mental health crisis between January and October of last year, 2025. Over the past 5 years, Wexford's A&E department has seen 5,105 patients presenting in mental health crisis, and would you believe it's incredible, 877 of them were children who presented at the hospital in mental health crisis. Now, what's truly terrifying is that these thousands of people had no dedicated mental health facility available locally. Now, I live on the Wexford-Wicklow border. It's a long way from Waterford Hospital, and in my office we received far too many reports of patients waiting and being referred to the very antiquated psychiatric department in Waterford City, only to be discharged or often refuse services within hours due to the lack of staff or the lack of space. I'm sure you would agree it's completely unacceptable to have this in 2026 in a country that is awash with money. You will accept that this adult psychiatric facility in Waterford Hospital is completely, my background is primary teaching and I'm involved in secondary schools. I'm sure you would agree it's a completely inappropriate setting for children in a mental health crisis to be sent into this antiquated unit, psychiatric unit in Waterford General, especially if you're coming a long, long distance away, say from North Wexford or from anywhere in Wexford or even South Wicklow. So I'm asking you, Minister, as responsibility for mental health, that funding will be allocated through the HSE Capital Programme for the development of a mental health unit that will be attached to Wexford General Hospital. Now, this is something that's regularly brought up on South East Radio. All the deputies here would agree with this. Every single councillor of all 34 in County Wexford, it comes up regularly at practically every county council meeting. They all agree there's cross-party support for this, so we really need to see movement on this in 2026. It's urgently needed so that people in acute mental health crisis can access timely, appropriate and safe care close to their home. It's been repeatedly left behind, this county, in terms of mental health services, and it's not just failing the people experiencing the crisis but also their families. So what we need is a whole family support and wraparound service. As you know, you have partners and parents and carers struggling to navigate a very fragmented system while supporting loved ones in crisis. These require accessible counselling, education, practical supports to help them understand and manage the challenges they face. So I find that the government has paid lip service to mental health provision and well-being, but have failed to deliver on the vision of change and sharing the vision. So the result is that many of the facilities are in a state of emergency and the funding has stagnated and reform has stalled. And so I kind of want to know what plans, Minister, you have or what the government has to address this mental health crisis in County Wexford. I know all about Waterford now, and I know how much budget, what the overall budget, but the money doesn't appear to be going to County Wexford in any meaningful way. So thank you. I'd be really grateful if you could.
Thank you very much, Deputy, for your question. And I suppose there's a couple of things I want to say. I am quite disappointed at how you have presented the situation in Wexford, and I think of all those working in mental health services in Wexford today, and I think they would be disappointed that the way you have said that Wexford has been completely left behind in relation to mental health services. So I'm going to approach it in 3 different ways. The first thing is we have as you know, we have 6 new regional health areas, and CHO 5 and 6 have been amalgamated. As a result, it's broken down into 3 subsections, 3 structures, and Waterford and Wexford are amalgamated in relation under one IHA, Dr. Sinead Reynolds, whose background is in mental health and a very strong advocate for mental health. So the first thing I want to say, I'm meeting her in the next 2 weeks in relation to mental health services across all Waterford and Wexford, and that's the first point. The second point I have to take umbrage with is in relation to how you have portrayed the Department of Psychiatry, led by the Clinical Director, Dr. Woki, in University Hospital Waterford, and you have on 2 occasions said it's an antiquated service. That is not true. Maybe you meant the building, but the service is not antiquated. So the first point to say is that when St. Senan's closed in 2013, before either you or me were in politics at a national level, and when St. Senan's closed, the decision was taken at that time that all referrals would be made to University Hospital Waterford. There were 42 beds in University Hospital Waterford, the Department of Psychiatry, but we also have a service level agreement with St. Patrick's in Dublin. I know this inside out, Deputy. I've lived it for the last 5 years as Minister for Mental Health. So we have a service level agreement with St. Patrick's, the private hospital in Dublin as well, when we have issues with capacity. Now, you have spoken about the amount of presentations of children to emergency departments in Wexford. And as you will know, when Wexford General had a fire there a year and a half ago, University Hospital Waterford partnered very closely with them to take any of the overflow that couldn't be dealt with at that time. So in relation to your comment that it's antiquated and it's not suitable for children, it's an adult unit. Only 2 children were admitted to an adult ward, an adult Department of Psychiatry last year across the whole country. Only 2, down from 100 when I took over in 2020. 2 cases taken in real time, when a clinician, a consultant psychiatrist, has to make a decision, normally in relation to life or death, should they admit that child, that young person, and in both cases they were 17 plus with the approval of their parents. So I can't let that hang in the air. But what I will say to you is that Wexford has been very well served in relation to community mental health teams. There are 6 adult community mental health teams in Maryville, New Ross, 2 teams in Carn House in Enniscorthy, Tara House, Gorey, 2 teams in Somerville, Wexford Town. There are also 2 CAMS teams, and there's plans in place to put a 3rd team in place. But I do accept what you have said in relation to no adult psychiatric beds, and I think that's the nub of the issue in Wexford in general. And this has been raised by by Minister James Brown on several occasions, and other representatives in Wexford. I do want to give a shout out though to Mental Health Ireland, who are very, very strong in Wexford, and I have over the last 5 years launched very, very many initiatives in relation to mental health, well-being, emotional distress in the Wexford area, and I want to applaud them for all the work they do on the ground. But going back to the issue that you have said in relation to acute beds, I am aware that there are none in Wexford, for example. I am aware that there are none in Tipperary. We have done a capacity review of mental health beds, and we will be having a look at this into the new year.